the drone that changed a tuberculosis patient's journey. For years, getting tested for tuberculosis, TB, in many remote parts of India was more than just a medical process. It was a difficult journey. Imagine waking up before sunrise, traveling for hours to reach a distant diagnostic center, spending hard-earned money on transport, losing a day's wages, and then waiting over 2 weeks for the test results. For many families, the cost wasn't just financial, it delayed treatment and prolonged uncertainty. In Telangana's Yadadri-Bhuvanagiri district, however, that story has started to change. The Indian Council of Medical Research, ICMR, through its flagship iDrone initiative, introduced a simple yet transformative idea. Instead of asking patients to travel long distances with their sputum samples, why not let drones do the traveling? Under the new system, patients could submit their sputum samples at nearby primary health centers and sub-centers in their own communities. From there, drones carried the samples directly to TB diagnostic laboratories through a hub-and-spoke network connecting 11 primary health centers, 60 sub-centers, and 4 TB units. The impact was remarkable. A study involving 840 participants revealed that the median turnaround time for TB diagnosis dropped dramatically, from 15 days to just 5 days. Faster diagnosis meant doctors could confirm the disease sooner and begin treatment without unnecessary delays, improving patients' chances of recovery. The financial relief was equally significant. Earlier, patients spent an average of 9,451 rupees while seeking a TB diagnosis, covering travel expenses, lost wages, and other costs. With drone-assisted transport, that average fell to just 91 rupees. Even more encouraging, the median out-of-pocket expense became zero, meaning many patients no longer had to spend anything to get their samples tested. Healthcare workers also noticed a difference. They reported fewer delays, smoother operations, and growing acceptance of the technology among local communities once people became familiar with it. Of course, the project wasn't without challenges. Weather conditions, drone payload limits, and the need for continuous training highlighted that successful implementation requires careful planning. Yet these obstacles offered valuable lessons rather than roadblocks. According to Drive, Rajiv Bahal, Secretary of the Department of Health Research and Director General of ICMR, affordable and timely diagnosis remains central to India's fight against tuberculosis. He noted that the study demonstrates how technology can bridge geographical barriers while reducing the burden on patients living in remote areas. The findings also strengthen the broader vision of the iDrone initiative, which is exploring the use of drones to transport vaccines, medicines, blood products, diagnostic samples, and tissues to difficult-to-reach regions across India. For the people of Yadadri-Bhuvanagiri, the buzzing sound of a drone overhead represents far more than a technological innovation. It symbolizes quicker diagnoses, lower healthcare costs, and easier access to life-saving medical services. Sometimes, the shortest distance between a patient and better healthcare isn't a road, it's the sky.